Hello, everyone. Welcome and thank you for joining the 35th webinar in our Pandemics and Society series. Today's topic is Ebola response in Eastern DRC, using Earth observation to improve situational awareness in hard-to-reach areas. I'll now pass it to our moderator, Wilmot James, Senior Advisor to the Pandemic Center at the Brown University School of Public Health. Wilmot?
So hello to everybody, wherever you are, and welcome, a very warm welcome to our discussions today. So as you know, the ongoing Bundibugyo Ebola outbreak in eastern DRC is unfolding in one of the world's most challenging operating environments. Conflict, population displacement, limited transportation infrastructure, border restrictions, healthcare disruptions, and community mistrust are complicating efforts to detect cases, to trace contacts, to deliver supplies, and to protect healthcare workers. Today, we will hear and see a presentation that explores how Earth observation, geospatial intelligence, and emerging AI-enabled analytics can support outbreak response by improving situational awareness in areas where access is limited, delayed, or unsafe. Rather than focusing solely on disease surveillance, which of course is fundamentally important, we will examine how satellite-derived information can complement public health operations through population and settlement mapping, displacement monitoring, transportation and accessibility analysis, conflict monitoring, healthcare infrastructure assessment, and food intelligence. We will be using the current Ebola response as a study to discuss practical opportunities to integrate Earth observation with humanitarian, public health, and conflict data to help responders better understand where people actually are, how conditions are changing, and where operational gaps may be emerging. Our aim with this discussion is to focus on actionable applications that can support decision-making today, while highlighting opportunities for stronger collaboration between public health and geospatial communities. To help us unpack these issues, I'm joined today, and I'm really happy to welcome our experts in the field. First of all, David Saar, who will be our featured presenter today. David is a professor and director of the Geospatial Analysis Lab at the University of San Francisco. He also serves as a managing principal and co-founder of the Spatial Informatics Group, as well as chair of NASA's Applied Sciences Advisory Committee. Welcome and thank you, David. He's a recognized global leader in spatial analysis, remote sensing, wildfire science, and natural hazard modeling. We are fortunate also to be joined by Dr. Robert Cohen, who will serve as our lead respondent. Robert is a preventive medicine physician. Importantly, he's a senior author of a 2025 paper on the origins of Ebola as a human pathogen. The title of that paper is Ebola Virus Evolution and the Emergence Associated with Land Use Change. The paper deals not only with the risk of spillover, but the shaping of the evolutionary journey of the pathogen itself. So I'd like to now turn it over to David Saar for his presentation, and please begin when you are ready.
There we go. Can you guys see my screen? Is there a thumbs up anywhere? I'm going to assume yes, you can. Wilma, thank you very much for the introduction. In addition to being a professor and a managing principal of SIG, one of the programs we run is SERVIR. And SERVIR was a former USAID NASA-funded program to bring space-based technologies down to village-level decision-making to deal with a wide variety of different use cases, including public health. What we're going to talk about today is some of the approaches that we think about when dealing with this issue. This all starts with valuing visibility. Just like disaster response, wildfires, floods, earthquakes, outbreak responses depend heavily on the shared ability to see, reach, and support affected communities where they are when the outbreak actually occurs, including communities that are typically outside the normal field of view, whether it's an emergency response agency or a public health system. And this is really important in these hard to reach settings where visibility is really hard to get. And so if you could see it, you could reach it, then you could support it. So everything we're going to be talking about here is using that lens. Now, when we switch over to responding to Ebola, it's it's hard to begin with, right? In the best case scenario. But in the Eastern DRC, it's confounded by conflict, human mobility, limited infrastructure, just makes a hard situation even harder. And so, like, responders are trying to detect cases, they're trying to trace contacts, they're trying to deliver care, often without a complete picture of what's happening on the ground. And so the idea is to identify where those challenges are and deal with them one at a time. On the mobility side, people are frequently, moving for work, for trade across borders. Disease doesn't follow administrative boundaries, so those administrative boundaries are meaningless in terms of actually quantifying the full picture of visibility. Conflict, there's challenges associated with that as well. It limits where healthcare workers could safely go. It also limits surveillance, contact tracing, and treatment becomes much harder in those zones. Logistics and operations are also a challenge. Roads are limited, travel is slow, many communities are remote. People getting people, supplies, and samples where they need to go takes time, and those networks aren't always stable. What might look like a road network at one period of time might drastically change for a variety of reasons in another period of time, whether it's conflict driven or natural disaster driven. And so the idea is that can you use geospatial data, including Earth observational data, to help fill some of these information gaps by providing a consistent, independent view of what's happening on the ground so you can increase that overarching visibility. So, like when we think through this one, there's multiple dimensions that we could actually map through. When you think about like on the environmental side, where is spillover likely? Where are there habitats or refuge of the primary hosts? Where are there disturbances associated with it? And then what is the interconnectivity with different populations? When we think about conflict, where is the response constrained? Where is there currently active conflict happening? Where are the hot zones? Where are the safe zones? And where has conflict damaged critical infrastructure, whether it's logistical infrastructure, public health infrastructure, access infrastructure? And then on the mobility side, where's the transmission likely to spread? Where are people going? What routes are they using? What are the major transmission corridors, and how do they relate to the first two components? And then on the logistics sides, how do we get people and resources to where they're needed to go? And in order to do that, where are those isolated communities? And what routes remain accessible? And where do you stage medical supplies? So if you have all these layers of information and you can update them pretty consistently, and you could fuse them in intelligent ways that are appropriate for the different decision makers that are responding to the crisis or trying to get ahead of it before it actually breaks out, you start creating these situational awareness layers that are both spatially aware and human aware. That sounds like a bunch of different theoretical stuff, but we'll talk through some examples where we can make this a little bit more real. Before an outbreak occurs, right? The idea here is like, wouldn't it be nice to be able to identify where where people are, where these niches actually exist, and where disturbance exists. So if you have those three sets of information, where you can map out that zoonotic niche where the primary host is, and you could actually track where deforestation is that's actually impacting their habitat, especially around high population dense areas. Then all of a sudden it's like, well, hang on a second. Now we could actually potentially identify spillover more rapidly. And potentially, if we get really good at this stuff, maybe we could actually limit some of the spillover factors to avoid potential outbreaks in the future. So in order to do this, the idea is like, well, let's get some really good land cover data sets, habitat mapping data sets that we can keep updated in the live stream. At the same time, map out disturbance regimes that are in that same setting adjacent to where those populations are located. So in this example, like let's figure out where the fruit bats like to live. Where are they, and what disturbances are occurring around there, and which disturbances are occurring adjacent to the major populations, right? After an outbreak occurs, right, the idea is to be able to do the same sort of thing. Can we actually map that spread throughout these regions and target specific locations? For example, mines are important for the Congolese economy. It employs thousands of workers, many of which travel long distances from remote provinces from way out there and neighboring countries, actually, to find work. And if there is a way to map that ongoing land cover component, that habitat mapping component, that zoologic niche component, in connected to where those population densities are, connected to disturbances, it would be really easy to identify potential spillover. So what you have here on the top right, that first map is a series of images that show an expansion of a mind. And what you see right below that is AI technologies used to identify different land cover types, whether it's a populated area, a water body, or the mines themselves and deforestation structures that are occurring around them, where you're actually showing them in live streams of what those interconnections could be. The next component is really on the conflict mapping side. So conflict complicates Ebola response, and it creates a whole bunch of different blind spots for healthcare workers. And if you look on the image down there on the left-hand side or the right-hand side, previous research shows that there's a linkage between these, right? As conflict rates goes up in specific geographies, Ebola cases also shoot up. And so if we could get an understanding using geospatial data of how conflict's impacting different components of a response, then the idea is that maybe we can mitigate some of that. And so the example that we have on the left-hand side is an image taken from May 2026, 22nd and 24th. And what those white tents are their public health tents. They are set up to help retrofit some of the public health infrastructure. And what you see between the two is that there's a missing tent. And what actually happened in that setting is that, there was some conflict, and we'll just leave it at that, parts of the community started burning down some of that infrastructure. So now, and you could use that as a signal, as a potential, hey, there might be a bump up in potential spread in that location. The next component is on the mobility side. So this isn't necessarily Earth observation on its own. This is more the geospatial component. And, disease displacement and goods move between these connected places. We know that, right? And connection between these places, we can't count people, all right? You can't count the number of people moving from one location to another location in an ongoing fashion. And so what happens is that you end up looking at artifacts of what those migration patterns are. Wouldn't it be great if we're able to capture mobility information in a way that protects privacy to help identify where some of the potential risks are? And so the solution is hey, how do we take mobility data and turn it into maps and map it over the previous elements that we talked about to show where connectivity occurs between places that have significant exposure to large communities that don't have that significant exposure yet. And so this identifies specific geographies that could potentially feed into other geographies. And so it's the same sort of structure, applies across all the different components that we talked about. And what we could do over here is, by using that mobility data, create these graph networks that actually identify what that connectivity actually looks like. So what you see on the right-hand side is a graph that summarizes that mobility data. The way that you could think about it is that each one of those dots is a specific community in geographic space, and you could populate that information with all the previous information we have. Like think of the a concentration of conflicts. Think about it in terms of contact with places where you have deforestation that's high, and or where communities are congregating around things like mines. And the lines between the different nodes shows source and sink of where people are coming from and going to. So the orange is more migration source, where people are coming from, and the sink is where people are going to. And then where you see that red circle is places where you have confirmed cases. And the idea here is like, well, in live stream, can you identify where that migration pattern is occurring and identify those choke points? And in this specific example, if you look at that node right in the middle, that seems to be a critical choke point between places where you have a lot of confirmed cases, a lot of potential sources, to a place potentially where people are going where you don't. And so setting up a screening facility potentially in that specific geography, given limited resources and potential safety concerns, might be the most strategic place to identify screening to contain an outbreak. And the idea would be is that you could do this sort of thing on top of the previous layers that we talk about in near real time. And this might be adjusting and changing depending on what's actually happening on the ground in real time. The next component is that you have infrastructure that is challenging to get to and challenging to respond to. So you don't have responders don't typically have a full picture of what the healthcare accessibility is. And remote communities, again, like we're talking about, are far away from diagnostic facilities. And when you look at just the realities of basic infrastructure, including terrain, it can create major travel barriers. And so the idea is that we can create an analysis on travel time to identify those geographies, time it would take to get to a nearest lab, right? That could factor into like, oh, well, maybe we need to spread out where the labs are, or hey, well, maybe we need to expedite accessibility to certain logistics if there's a breakout in a certain region, and that makes that more real. On the other side of it, the golden hour, if we could identify places where there is a diagnosis and you can get them to a place where they can get care within an hour, where are those geographies? And so what you have on the right-hand side is a service area map, which actually models that out. Where are the golden hour accessible geographies? What are the populations associated with it? Where are the choke points associated with it? And on the flip side, you have the same sort of thing, but on the diagnostics side of the conversation. And like I said beforehand, with the mobility component, um, these elements are dynamic. And so if you go back to the conversation about, conflict being affected in these areas, or even disasters affecting these areas, these roads and bridges that connect all these different communities could be affected by a wide variety of different things. And what was once accessible could be isolated in a matter of an activity or two. And so using Earth observations, you could actually identify what part of that infrastructure is intact and what part of that infrastructure is non-accessible, using a wide variety of AI detection methodologies. And then you could feed that into the previous slide that I showed that gave you that accessibility map. So imagine those accessibility maps being dynamic based off of the observations that you're actually viewing. And imagine that being connected with the previous observations that we talked about in terms of where disturbance occurs and all the other things we talked about. If you're able to do that, then all of a sudden you can match that up with infrastructure measures as well. And so what you see right below that, this was done by our partners in Venezuela right after the earthquake, is how many structures were actually taken out. And that could also include public health structures. So fusing that information together rapidly helps accelerate that visibility that we're talking about. Now, going back to the Severe program, and why are we thinking about this um, at a large scale and a local scale, is that what we've learned from Severe is that building out a wide variety of locally specific applications right from the very beginning makes it very hard to scale and to adjust and to transfer to other places that need those same sorts of technologies rapidly. And so what we've done is that we've created a shared backbone of analytics that is modular in nature, global in nature, that combines a whole wide variety of different modules. Think of a deforestation module or a population module or a conflict mapping module or a disasters module or land cover mapping that's dynamic, habitat mapping that's dynamic. And if you're able to get all those different modules and you're able to accelerate it using a variety of AI techniques, and we'll talk about that in a second, not only do you get better real-time assessments, but you get better predictive capabilities. And if you're able to put that into a sustained support component that allows a wide variety of public agencies to use it as a public good, then the idea would be is that we could actually increase the impact of these overarching systems in those places that need it the most in a more rapid environment. And when we talk about AI technologies and how it relates to Earth observations, to everything that we talked about beforehand, the field is evolving rapidly. And so the way that we think about it is you have a wide variety of Earth observations, and the speed and the quantity and the quality of those observations are accelerating on us. Typically, we use machine learning models to build out those land cover maps or those damage detection maps. We're going to get overwhelmed by it relatively quickly in the next 5 years to a decade. We're not going to be able to do things the same way we used to. So using Earth observable foundation models that fit on top of, high quality field-based information that comes in from a variety of different sources, including things like Collect Earth Online and Ground, we can build models that are cheaper to produce, that have more skill, that are locally relevant. If we're able to get those information flows put into these work flow management systems, orchestrators that connect to a variety of different microservices, think of like a flood map or a habitat niche mapping application, you can make it more accessible using these LLMs. Think of like Claude or Codex or Anti-Gravity from Google, where you're able to prompt engineer the solution sets that you need and build applications that are user specific in the field, in a local language, in a local dialect, in a reporting structure that's meaningful to that local response that sits on top of a global infrastructure at scale. And so what we're thinking about is a public health intelligence platform that takes all the types of things that we're talking about, from the day-to-day preparedness and planning, risk monitoring, to the projection and forecasting where these things occur, to emergency response in terms of the conflict awareness, some stuff that we talked about there, and then locking in potentially some novel solution sets that help fill that visibility gap. In terms of building trust, and this is sitting on top of 20 years of severe legacy, trust really depends on local ownership. So how do you develop these sorts of solutions that leverage all of this emerging technology, global infrastructure, global support systems from a wide variety of different networks, and co-design and co-develop with local partners, and there's some of the partners that we have down below, solution sets that are really targeted to a variety of different end users to make this stuff really useful. And so when we're thinking through this problem, this space, taking the field of expertise that we're comfortable with, which is environmental science, into public health, not public health into environmental science, this is where we need partnerships and collaboration. What is the best mechanism of doing this? Using a co-design, co-development approach. And with that, I am good on time. We're going to have plenty of time for conversation.
Thank you very, very much, David. You walked us through some quite complicated efforts, and just thank you for communicating those in a way that you did, which is really quite clear and incredibly insightful. And you also mentioned what the applications are and how those applications intersect with public health response on the ground in relation to community. So that was really, I really thank you for that. Before we open up to questions, I'd like to turn to Robert, just to spend 5 minutes or so with us as a first sort of lead-in respondent to David's presentation. Over to you, Robert.
Yeah, thank you, David. So obviously this era of AI is an extremely exciting time technologically, and an Ebola outbreak is an example, given the challenges in this area, where technology might really help us. We think, of course, that an Ebola outbreak is a 1 in a million event. There are millions of human-animal interactions happening all the time. We don't actually know which bat is the reservoir of Bundibugyo, the one that's happening right now. We don't know if it's a fruit bat on farms or a bat that inhabits houses or mines. And this kind of technology can accelerate that effort. And I would also note, some Ebola outbreaks are controlled very rapidly, and some are not controlled rapidly. And the worst two each cost more than $1 billion to bring under control. And so this kind of technology, all the different things that David mentioned, the multi-sectoral aspects of an Ebola outbreak, not only conflict, but also human mobility, deforestation, all of that, I think, can make a quantifiable difference in how we both prevent the number of Ebola outbreaks that happen and as well as reduce the severity of them. Of course, as people probably know, we've been dealing with Ebola for 50 years. It was literally 50 years ago this month that the first ever Ebola outbreak occurred in South Sudan, right across the border from where the current outbreak is occurring. Last year, my team published a paper on the origins of Ebola Sudan and Ebola Zaire. So not Bundibugyo, the one that is now causing this significant outbreak. But there was some really cool findings in our paper that I believe the link was just posted or is about to be posted that we can build on with this kind of new data. Of course, we didn't have severe and satellite data back in the 1950s, but we did have other types of land use data where we could probe the origins of Ebola and how did these things start to spill over in the first place. So the paper's 15,000 words. I won't summarize it all in the next 2 minutes, but AI can certainly help with that as well if people are interested. But what we did is we took the 2 Ebola viruses with the most genetic data, and we used phylogenetics to detect where and when the common ancestor of all current known strains was circulating. And Ebola Zaire is more complicated, so I want to focus on Ebola Sudan because it's actually quite clear. So we traced the original strain of Ebola Sudan to this part on the South Sudan DRC border, literally right next to where Bundibugyo is happening right now in that polygon. We sort of said that it's in that range. It was circulating in that range around 1950, according to genetic data. And then we were able to use what the previous version of Earth observation data to ask how that land use had been changing over the last 100 years. And if you look in that polygon there in the middle, you can see that from 1900 to about 1940, it was all dark brown. That's all wild savanna. And then you can see just north of the border that dark brown turns to light brown. And that is a dramatic change in how the land was being used. And you can see that, so this is based on geospatial modeling, completely unrelated to Ebola data. So it's a completely independent set of data that shows that land use in the area where Ebola Sudan's ancestor was circulating changed right around the time it started to spread as a human pathogen. And if you go to the next slide, this is when it gets particularly interesting. There's more molecular data that I won't share today. One more. Got some animations in here. So I actually found a paper from 1955 that showed what this area looked like. So this was an area that was previously, as noted, wild savanna, and an agricultural program was started to essentially convert all of that savanna to cotton agriculture. It was called the Zandi scheme. And you can see pictures here on the left of cutting down the wild bush and replacing it with cotton farms and a cotton factory. And if you start clicking through the animation, so 2 decades later, the first case of Ebola Sudan, the first ever Ebola outbreak, occurred in this factory Ebola antibody positivity in the cloth room was 37%. And one more click, and the epidemiologic investigation revealed that there were bats of the specific species Mops treveri roosting in the ceiling of this cotton factory. And so what we saw was, if you cut down the wild bush and replace it with a new structure where bats like to roost and bring them into closer contact with humans, it created the conditions that Ebola would start to spill over, Ebola Sudan specifically, would start to spill over into the human population and then also start to spread. So we also showed that several outbreaks of Ebola Sudan have occurred in exactly this region, and then it actually shifted genetically and started to spread into Uganda, where it's actually caused more outbreaks, but all since 2000. So the disruption of the South Sudanese savanna led to the evolution and spread and dispersal of Ebola Sudan into Uganda, where it's caused a lot of issues. So now we're looking at a new virus, Bundibugyo, that just started in 2007. We don't know its host. We don't know how it spreads. We don't know which of the 7 factors that David mentioned are driving both its spread and the severity of this outbreak. And all of that exciting technology can build on the last 50 years of Ebola research. And with that, Wilmot, I turn it back to you.
Thank you very much, Rob, indeed, for that. And it's really good to have a real historical sense of how things have developed and evolved, and to essentially look at, in a reverse fashion, at what drives epidemics like this. So thank you very much for that. So we are now going to go into a discussion session and Q&A session. And if I can get that going by speaking about community involvement. I mean, trust is everything. We see there's major distrust in the DRC as elsewhere, and communities react to the lack of trust. And so the question is, in 2 respects, David, is there a way of integrating community-led reporting and also behavioral data into existing geospatial models to improve predictive abilities? And linked to that, is also to ask about how we ensure that local communities potentially being monitored are actually active parties in this data and how they can benefit from it.
Significant yes to both, right? So the best information we can get to build these models actually come from the field, from local experts, technical experts that are able to make those real-time observations. So the way that we do it, at least on the deforestation side, typically there's, let's go back to like illegal gold mining in the Amazon basin. In that setting, what happens is we have these tools that actually identify when gold mining actually occurs. A signal is sent to local operators to go on into the field to confirm whether or not that actually did occur. Once they say yes or no, it goes back into the model to improve the algorithm, but it also goes into a secondary system to identify whatever the appropriate mitigation or intervention schema is. The same sort of approach or the same sort of technology could be deployed in this setting as well, where you could pull in a wide variety of community-based information. And it doesn't necessarily need to be structured. It could be unstructured, a story or a narrative that identifies what's happening in a specific geography, could help with that type of mapping. We use a lot of that in the conflict mapping space. It's hard to get proper field-based information when you're trying to verify what's happening on the ground in a conflict. So typically, you're spending a lot of time getting unstructured information from community members to confirm what you're actually observing. The same sort of thing could be done in the public health setting.
Thanks very much. I'm going to turn to Robert. Robert, you can turn your camera back on and turn the mute off, because we need to have a really dynamic conversation. So feel free to jump in. So if you have any slides,
you listen, those slides are amazing, by the way.
So any comments, Robert, on that particular question?
No further comments on that question.
Okay. So I have a question also on data from Jake Jordan from the Nuclear Threat Initiative. And the question he posed was, what additional data streams can geospatial intelligence be combined with in the future to provide new insights on health security vulnerabilities or close critical existing gaps.
Robert, you want to take a first crack at that, or you want me to?
Yeah, I'm happy to. So, I'm very interested in preventing these outbreaks from happening in the first place because we could save $1 billion a year, potentially. These outbreaks are now having every year. So, we showed in our paper that forest fragmentation is the strongest driver of Ebola outbreaks, and that kind of makes sense because fragmentation increases the surface area through which you can have human animal interaction. So, if it's increasing the number by tenfold, then obviously that's increasing the risk of a spillover by tenfold. There's still so much we don't know about which bat and exactly how, for example, do they spill over through a direct bat to human interaction? Is it in the caves? Is it in the mines? And aligning all of those data to try to get a better sense for all the Ebola viruses would be very valuable. In addition, there was recently an updated database of bat ranges that was published based on how the many uncategorized species of bats for which the data is very incomplete in the area of the world, namely the Congo Basin, where the highest risk of Ebola outbreaks emerge. All of that data needs to be mined and overlaid and combined. And frankly, I think AI could add a lot of value in terms of detecting patterns and nuances that are not yet detected to figure out why these spillovers occur and how we might reduce the risk.
And can I add on to that a little bit? There's there's a bunch of emerging technologies that help not only aggregate that set of information, but collect new sets of information about habitat type and habitat diversity. And so Conservation X, for example, they have a whole network of edge detection systems specifically targeting different types of wildlife. So imagine identifying a geography like this where an issue is occurring. And the idea is you don't have enough population information to identify where the species are actually occurring. So you could actually build a better habitat niche map. You could use that edge technology and think about things like automated camera traps, or think about things like Alexa in the forest that you're listening for different types of species of animals and then identifying them and using that as observations to build a better habitat map. Those technologies are rapidly emerging. And if we can get those sorts of things to be deployed in these sorts of settings to augment the type of data streams that Robert's talking about, then all of a sudden you're building an agile system to quickly assess what's out there. What is there a cause and effect between a specific species, a specific land management activity, and a specific population center in ways that we haven't been able to address beforehand? And it sounds like it's far-fetched. The stuff's becoming more and more accessible.
Yeah. Just could you talk about the ability to map the food sources for those bats and the real potential people worry about with changing rainfall patterns, for example, and different geographical spread and also intensity affecting food sources for bats because they need to feed and they migrate. They're also in terms of how hibernation is being affected by temperature changes affecting caves, for example. Anyway, so
that goes back to the habitat mapping. So typically when you think about the habitat of any species, including a bat, they got to sleep someplace, they got to eat someplace, they got to breed someplace. Yeah. And so if you get an idea of what those dimensions are and what the environmental conditions are for that to be successful, and what the interactions of those are with disturbance regimes in the populations, that's one thing. And then if you start, to your point, if you start looking at how those things are climate adjusted, as climate changes within a geography, in addition to the anthropogenic disturbances that are already occurring in that area, could you predict, if you want to use that word, where potential occurrences are going to be forecasted in the future? And all of a sudden that will start working, but it goes back to getting a better understanding of what those habitat characteristics are and what impacts those. And like Robert was showing right from the very beginning, is the disturbance regimes in terms of forest cover is a great start, but there's additional dimensions that we could add to improve that skill. Go ahead, Robert.
Yeah, I want to bring everyone's attention to a really great paper published 2 years ago on a different bat-borne virus system, Hendra virus in Australia, by Raina Plowright's group. It showed that the El Nino weather stress on bats was clearly stressing the bats, and actually they were able to show that that increased the risk of a Hendra virus spillover into humans. Those kind of data could be mined to
Yeah.
analyze Ebola. It's probably the case that many different Ebola species, of which there are at least six, at least four of which are known to infect humans, if there are certain types of environmental or climate stress that increase the risk of an Ebola spillover, that's the kind of methods that could be applied with the rapidly accelerating technology.
Okay, thanks. We have a question from Jonathan Eubank from Arena. And the question goes as follows: what is the range in temporal resolution? So it's a range in temporal resolution for the different type of data that you presented. So this is addressed to David. And is having high temporal resolution for some types more important than for others?
So if you look at like the Landsat archive, the funny thing about that is that started the month and year I was born. So it's July 1972. So that's when that archive started. And if you look at the spatial and temporal cadence of it, it's improved over time, and it's been augmented by a wide variety of other sets of observations. What's interesting, using some of the AI technologies that we were talking about, there are mechanisms and methods for downscaling and improving the spatial scale and temporal scale using these interpolation techniques to create like these synthetic-esque data sets that let you go back to that time period. But that's about the longest period we have. If you go back to and you look at Robert's life and you go back before that, there's different survey data and stuff that you could use to augment if you wanted to go further back. Now, when you look at mobility data, the mobility data is much harder to access, and the time periods that you're looking at for that, it's they've been accessible for the past 20 years. They're really available at any sort of accessible element, if you want to call it that, in the last 3-4 years, just because of there's price constraints and that kind of stuff associated with it. When you look at the temperature information, like the climatological information, which I didn't show, but it's important to this entire conversation. There are historical reconstructions that go back quite a long time, and there is forecasts that are projected about 100 years out. So in terms of if you're to think about this as locally specific information, mobility data, field-based observation, that sort of stuff, it's kind of scattered, limited, pocketed. If you think about the Earth observations, really 2017 to present is probably the golden era, and it's going to get better. But if you needed to reconstruct, start from 1972, go forward with 1985 probably being the best place where you can start getting 30-meter resolution. When you're thinking about climatological data, it's a much longer time period.
Thank you. Robert, you have a comment on that?
Yeah, and so the satellite data certainly brings a whole new component to how we analyze this. I was very excited that the history of the land use data over the last 100 years, because of course these viruses have circulated in bats for thousands of years, and now they're only starting to spill over in at least the last 50. And we at least have evidence that it might really have started just as these habitats have been so transformed. Those land use data were just updated to be available every year since 1950, potentially the period in question, even before we started to have this real-time geospatial data. And then, of course, the genetic data, which is the other area that I'm very focused on, that's, of course, very precise. Now we have, we didn't used to have full sequences of a lot of the outbreaks because sequencing technology was so much worse in the past, but now we've got rapid sequence data that allows us to identify exactly how quickly things are mutating compared to the previous outbreak, and it provides a lot of granularity to get an idea for exactly where these viruses are circulating in their reservoir.
That brings up an interesting opportunity as well. Have you heard of environmental DNA, eDNA?
Mhm.
You see what folks are doing that. Is there an ability to lock in eDNA approaches with some of the DNA approaches that you're talking about to use that as a potential signature?
I think that's a great idea and grant proposal. But yes, I mean, I would just say, the history, as people may know, of trying to identify Ebola DNA in bats is very limited. We still don't have concrete proof that Ebola is in bats, although we are pretty sure based on an abundance of circumstantial data. But they've only 4 times found an Ebola RNA sequence in a live bat. But now that we're getting better at sampling environmental data on fruits or something like that, especially you might go to the Mongbalu area where this outbreak originated. We'd sure like to know where it came from, and with good environmental sampling, we might be in mines, for example, we might be able to get some good clarity on where this virus spilled over in the first place.
So just a reminder, the point of all this is early detection. Early detection allows for containment, it saves lives, and downstream it saves money. So in that particular order, saves lives and saves money. So getting this right, actually, given the superb development on the technical side, we must get to the point where we are able to say that we are applying our expertise, we are applying the technologies, and we are applying systems in order to have early warning and early detection systems for things that are not easily recognizable. So let me turn to 2 infrastructure questions that have popped up. The one has to do with what the gaps are in communication between states and communities within the affected areas, and how that is enabled or compromised by poor connectivity, poor systems of electronic communication, and essentially what the infrastructure is presently within a very difficult part of the world, which is the DRC. So those infrastructure questions to do with raising all kinds of barriers for effective communication. David.
Yeah, no, I mean, so in terms of Ebola, I don't know, to be frank, but I do have some um, surrogate examples that we could talk about in the same sort of communication limited environments. And I'll give you a different example, then maybe Robert, you can give a specific example around this. If you go to West Africa, there's a bunch of pastoralists. They have their goats. They need to take them to these water sources. If they take them to a historic water source that doesn't have water, they lose the entire population, and it happens over and over again. And every time they make a decision, it's a high risk environment for them, and they don't have a lot of connectivity, and they can't see what's happening on the ground. So in that environment, we set up basically a monitoring system that allows them to identify which locations are most critical for them to manage their herd of goats, and we communicate with them in the most efficient fashion that's useful for them. Some cases it's a simple text message. Sometimes it's just a radio feed. So you take all this high tech, you basically generalize it down to a critical decision point, and you get it targeted to a specific decision maker for them to make a specific decision. And that sort of communication strategy we use in the wildfire space quite a bit. We also use in the food security space quite a bit. And it seems like in this context, it's going to be the same sort of limitations and targeting of what those channels need to look like. What we also found is that a top-down approach is very difficult to implement because there's a whole bunch of different trust components that are hard to overcome. So that co-development cycle at a government level, a provincial level, and a community level all has to happen in parallel. So at least you get consistent information flowing between those different organizations, and then the individuals at each of the different levels gets the information that they need in the format that they need and the timing that they need. It seems like in this context, it's going to be a similar sort of requirements. And Robert, I don't know if you have anything specific to Ebola that you could actually talk about.
Well, what I would just say is, Ebola outbreaks can be in the dozens or in the thousands, and it is heavily dependent on how effective contact tracing or vaccination is. And as David mentioned earlier, the trust in this area of external authorities for a whole host of historical reasons is low, and that is going to lead, and it puts the healthcare workers who have to do the contact tracing in an extremely difficult position. They tend to die disproportionately, and it's a lot to ask of a healthcare worker to be willing to die to control an outbreak, and a lot of them won't. And so the infrastructure is certainly part of it, but it would be remiss as a healthcare worker not to mention that taking care of the healthcare workers and getting them the PPE that they're going to need is going to be equally, if not more, essential. And I think we all should brace ourselves that this is probably going to be a pretty bad outbreak where leveraging all the technology to make everything else as easy as possible will be useful.
Thanks very much, gentlemen. So let me just say that to deal with any pandemic, including what is now the Ebola outbreak, which is regional in Africa, requires collaboration between partners. And the partners involved presently would be the Africa Center for Disease Control, WHO, AFRO, and also Doctors Without Borders, and then there are other partners as well. But those are, and I know there's been discussions between yourself, David, and your team with the Africa CDC. We've alerted WHO, AFRO about this. If you can just give us an update on where that is, because this collaboration is everything and partnerships. We have to work together on this front. If you can just share what you can.
Sure. Like our goal is scaling. It's like, let's identify and scope what the project is. Let's figure out how we could actually scale it. What kind of partnerships are most important to actually deploy inside of that. We're not, so Spatial Informatics Group is a small environmental think tank. There's a lot of technology and capacities that we're dependent on partnerships for. So AI2, for example, is one group that's connected to the FFST fund, Paul Allen Fund, that actually builds a lot of different technologies that we would be able to leverage and use for the CDC. Another group would potentially be Google. We're dependent on Google Earth Engine and some of their AI techniques to scale observation. Same thing with NASA and NISA. So as we talk to the Africa CDC and we go through the different talking points that we have over here, is what are the different priorities that they want to use? What kind of partnerships do we need to build? How do we actually build this in an open setting? Who are the folks we're going to co-develop with us on the ground? What parts of academia, what parts of industry can we pull in to help increase skill and adoption? We're in that part of the conversation to identify what those different components are.
Okay, there's also the question about vaccine delivery when that becomes available. So the whole question about the vaccine rollout has been very, very difficult, obviously. Could you comment on that? There's a question from Linda Stewart.
Yeah, I mean, I think that goes back to like the mobility mapping. And again, I mean, that's a place where we could potentially contribute. So that if we could actually identify where those choke points are, make that more granular, and then hand that over to folks like Robert or folks that are actually in charge of actually deploying those vaccines. Like, here's the different dimensions that we're seeing, and this is what it's looking like on the ground. That visibility, that additional visibility, could help with some of those management decisions. And the idea too is like it needs to be agile, right? So things might shift or change. A mine might open, or there might be an outbreak in another micro outbreak, if you want to call that, in another geography. Being able to sense that and capture that relatively quickly and get it into those health workers' hands as fast as we can to help them with their surveillance is the places that we could help with the conversation.
Robert, any comment?
No real comment. I think everyone recognizes the challenge here of not even having a vaccine yet, and then getting enough contact tracing for an effective ring vaccination strategy. which did work both. I mean, it's true. She's absolutely right that it worked in 2014, and it was also used in the 2018 Zaire Ebola virus outbreak that occurred just in the neighboring province. So it's possible that that's the best we have. I'm sure vaccine experts are thinking about innovations.
Yes, indeed, and CEPIM, I mean, the Coalition for Epidemic Preparedness Innovation, is working hard at driving that process. So we're reaching the end of our time. I'm going to give both David and Robert a chance just to make any closing comments that you would like to make, and then we need to wrap up. David?
Sure. Yeah. No. This is a complicated challenge, and with a variety of emerging science and technologies. One thing that's really clear is that this interdisciplinary, transdisciplinary approach to dealing with this is something that is needed, and building it in an open setting that actually is co-developed with folks that actually need it the most is the way forward. So unlike what we've done in the past, where we really focused on competitive science, competitive grant making, the need for a collaborative science, collaborative fundraising and resource mobilization is needed more now than ever. And building those skill sets and building those partnerships is something that's critical, and it's something that we hold dear to us. And keeping that in the open science, open technology space is something that we're going to keep advocating for and pushing forward with partnerships that we have here in this room and hopefully elsewhere.
And I thank you for those really great words. Partnerships are everything, and we agree with the principles you just outlined for how those partnerships are to be put together. So the last comment from you, Robert?
Yeah, I would remind us that Ebola outbreaks will keep happening as long as we keep pressuring the environment in an unsustainable way. We've known that for a very long time, and yet the increasing pressure on the wildlife habitats continues to accelerate due to all sorts of factors that are modifiable. If you look at a Google Earth image of Mongwalu from space, you can see how much deforestation has occurred, and it is really not a mystery how that would have led to this latest outbreak. I would also say in the aftermath of COVID, which among other viruses is probably also from wildlife and the pressure we're putting on wildlife. I would urge the global community to do everything we can to stop putting unsustainable pressure on wildlife and try to both protect their habitats and in the process reduce human mortality and economic consequences from these yearly zoonotic outbreaks.
I love that.
Yep. Yep. No, thank you very much, and we concur. So thank you very much to you, David and Rob, and to everybody else who joined us today for what was, as you saw, a very productive, timely, and robust discussion. The Ebola outbreak has not been contained, so everything must be done together in order to use what expertise we have. And clearly, as you've heard, our partners are at it. So thank you to the team at the Pandemic Center who helped put this together. Bentley Holt, Michael Mitchell, Leah Lovgren, and Amanda Kogan. To stay up to date on future sessions, please use this QR code on screen to access, here we go, to access our link tree. There you can sign up for our webinar mailing list, catch up on our past recordings, and explore other resources like our weekly tracking report, which includes updates on topics like measles, flu, mpox, and other emerging global outbreaks. A recording of today's session will be available on the events page of our website next week, along with other previous webinars. If you enjoyed today's webinar, you can sign up using the QR code on the screen for email alerts on future discussions. Please follow us on social media for updates, and feel free to reach out with any questions or suggestions. We'd love to hear from you. Thank you, ladies and gentlemen. We are adjourned. Please be safe, be healthy, and stay engaged. And of course, enjoy the soccer. Okay. Bye-bye.